Hello everyone, it's Dr. Dave. Hopefully you're all doing well. You had a nice weekend. You're looking forward to a good week ahead. I hope you have a great Monday to start things off. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for Monday, June the 14th, 2021. I'm going to look at 6 areas of health and wellness. Somewhere around this video, you can read through all 6 areas. If you would like a copy or you have any questions, you can email us, give us a call here at the clinic, or DM us on social. We'd be happy to help you out. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, to get your week started, and Monday through Thursday each week, we send you a video format, a written format on Fridays, so that you can stay tapped in, tuned in, turned on to some good health and wellness information, which may just help stimulate your own thoughts, decisions, and actions when it comes to your health and wellness, which is always time and effort well spent. Keep that momentum going. So, the journal Neurology is talking about nutrition in May 2021, and it specifically talks about one of our favorite diets here on the Daily Health Update, the Mediterranean diet, and how it may help protect the brain. According to a study that reviewed brain imaging and cerebrospinal fluid samples, greater adherence to the Mediterranean diet, this is an eating pattern focused on fruits, vegetables, nuts, fish, olive oil, and whole grains, while avoiding red and processed meats, dairy, saturated fats, and refined sugars, is associated with less buildup of amyloid plaques and tau tangles in the brain, which are often observed in patients with Alzheimer's disease. So a good diet musculoskeletally helps with inflammation, keeps it low, but also good for brain, apparently, according to the journal Neurology. In the journal Medicine, May 2021, they looked at sedentary behavior and how that could be linked to chronic obstructive pulmonary disease or disorder. COPD is a chronic lung disease that makes breathing difficult, and it's a leading cause of death in the United States, probably North America. An analysis of data from the Chronic Disease and Lifestyle Population Survey in Sichuan province of China identified an association between the amount of time an individual spends engaged in sedentary behaviors and an elevated risk for COPD. So fitness is not always about how the body looks. It's more important about how it stimulates its physiology, ensures that all your parts are doing what they were designed to do, and getting out and staying active helps keep those parts functional, including your lungs. The Journal of the American Medical Association Otolaryngology, Head and Neck Surgery, looked at chronic sinusitis and how that may affect the brain. An analysis of brain scans and mental health assessments of over 1,200 adults revealed that people with moderate to severe sinus inflammation exhibited altered activity in the frontoparietal network in the brain, which is important for problem solving and decision making. So if you have sinusitis, there are some treatments available both medically and through the paramedical professions. You may want to contact a naturopath or even a homeopath to see if there's something you can do to get that inflammation down in the sinus cavities. Not only annoying and symptomatic in and of itself, but could be having effect on, again, the brain function. So Nature Communication, April 2021, it talks about sleep and its value, but this time linked to avoiding dementia risk. Following an analysis of data concerning nearly 8,000 adults, researchers report that sleeping 6 or fewer hours a night in middle age is associated with a 30% increased risk for dementia in old age. The findings suggest that screening for sleep issues in middle age may aid in the prevention of dementia in later life. So if you're trying to get enough sleep and you're trying to get 7 or 8 hours a night, but it's just not happening, you're not falling asleep or staying asleep well, it's good to get assessed and see if there's something that can be done to improve that sleep quality. And if you're getting less than 6 hours simply by the nature of your life and work and your busy schedule, you may want to try increasing that. It could pay off in the long run with some good health dividends. Sleep, of course, very fundamental and valuable. Finally, the Journal of Bodywork Movement Therapies, January 2021, looked at fascial manipulation and how it helps to reduce pain and disability. They did a systematic review and they found that manipulative therapy to improve fluidity between soft tissue layers, which often become denser and stiffer with age and injury, can improve pain and disability in patients with musculoskeletal concerns or problems. So fascial manipulation in the treatment of pain in general, back pain, neck pain, and other musculoskeletal conditions is common amongst chiropractors. But there are some people who specifically focus on the fascia as well. People like fascial stretch therapists. There are people who manipulate purely the fascia. One focus similar to that with connective tissue is a procedure or a technique called rolfing. You may want to look into if you've never had your connective tissue released. Very effective, and they get in there nice and deep, and there will be benefit, especially if you are having symptoms of discomfort. But otherwise, if you haven't had any tissue work, never mind just massage, but also connective tissue or fascial work, it does tighten over time. You could have scar tissue and adhesions in there that sometimes aren't addressed with a regular massage, depending on the focus and the nature and who that therapist might be. Now, that doesn't mean that one is better than the other. Each has its own benefits, and it's good to address those fascial tissues in the body, the connective tissue, as well as all the other tissues to keep us going. So that's something for you to consider. All right, so that's your daily health update for Monday. Hope you have a wonderful start to the week. Take care of each other out there. Make it a good one, and I look forward to chatting with you tomorrow. Take care.